So Health Canada has approved the Pfizer-BioNTech vaccine in Canada, and tens of thousands of people are set to start receiving it. They will, of course, begin with priority populations, vulnerable people, healthcare workers. We're joined now by Major General Dany Fortin, who's been named VP of Logistics and Operations at the Public Health Agency of Canada. He is a veteran of military operations in places like Iraq and Bosnia. Thank you very much indeed for joining us, Major General.
Hey, thank you very much. Good morning.
Give us an idea, what will the military be doing? I mean, will there be military trucks actually driving the vaccines around?
Well, I can tell you that I'm leading a small team of logistics planners, and we established a national operations center and an operations hub here at the agency to bolster capacity. The Canadian Armed Forces also looking at the different contingencies, identify areas where they may be of added value, to include transportation if required, and a number of other things. But I'm not really here to speak on behalf of the Canadian Armed Forces. If there are risks, or if there are gaps at any level of the provinces and territories, they will look internally. They will look to federal to provide assistance, and it could be from the Canadian Armed Forces, but that would be speculative at this time.
I think Napoleon said an army marches on its stomach. Logistics is often the factor that wins battles and wars that people don't talk much about. Tell us how your experience will help here.
Well, we're certainly experienced in the Canadian Armed Forces in terms of managing crises of different types. In this case here, bringing experience, bringing knowledge, different expertise to bear to help bolster the Public Health Agency. They didn't have necessarily the numbers of people to really focus on this. So we are coming here with some of those expertise and experiences and really helping out.
How will the vaccine be actually brought to these priority populations? Will it be brought to the long-term care homes and brought to the hospitals, or will people have to come in and get the vaccine?
There are different types of vaccines. Right now, we're all focused on the Pfizer-BioNTech vaccine that has not just been approved, as you know. Pfizer has its primary logistics service provider, UPS, and will bring it to, and use different routes to bring it to Canada to the different points of use where the vaccine is administered by health professionals in the provinces. I guess a follow-on. When we have more stability data about the vaccine, we'll know together with Pfizer, we'll know how far we can continue to push. But more sites will be made available at the provincial level for people to go to, or the product to go to them, and that's very much a provincial, part of the entire distribution.
That's the vaccine that needs the very cold, low temperatures, I believe. Is that going to add to the challenges?
Well, it's a more complex, more challenging situation for sure at all levels. And we have established an ultra-low temperature cold chain throughout, from the manufacturer to the point of use in country. It's a shared responsibility to ensure that it's closely monitored and it's administered in the right way. And products, as they arrive to points of use, there's a process that Pfizer-BioNTech has shared with us that is very clear. The health professionals have been trained, and equipment is in place, and we're ready to receive and administer. Provinces are ready to administer that vaccine. Yeah.
Do you have all the equipment, the refrigeration equipment you need? Is it available right now?
We do for the initial sites. More freezers, ultra-low temperature freezers on the way. They're being distributed. More will be distributed as we turn additional sites. There's also the thermal shippers that the company sends that can also be used to store, and fridges to store once the product is thawed and can be maintained in that state for several days. So we have a robust system in place. We've supported the provinces in establishing that. And we're also looking at Moderna and other vaccine candidates with their unique requirements. So simultaneously, we're rolling out a cold chain or distributing equipment to add to provinces and territories' capacity so that they are able to receive, prepare, and immunize people with the cold vaccine or the frozen vaccines.
You were involved, I understand, in the planning to have the military go in and really clean up at some long-term care homes in Ontario. Can you tell us what that experience was like? I imagine it was emotionally wrenching for some of the forces members who saw pretty horrific conditions.
I was involved as the commander of Joint Task Force Laser back in the spring. At the time, we had forces assigned and prepared for a number of contingencies. This was one contingency in the long list. And Canadian Armed Forces members we organized teams of teams to help bolster capacity of the different long-term care facilities in Ontario, in the Greater Montreal region. And we're very, very proud of the work that they did there.
We'll leave it there. Major General, thank you very much indeed for joining us. Major General Dany Fortin has been named VP of Logistics and Operations at the Public Health Agency of Canada. He's going to help oversee the distribution of the vaccines.